Whether it's the kind of anxiety that makes your heart race before a big presentation or the chronic debilitating kind that affects daily activities, anxiety is something that most of us have experienced. In today's fast-paced society, anxiety is becoming increasingly common. Welcome to Focus on Health, a show on all matters health, wellness and lifestyle. I am your host, Joy Bofenda, and joining us today is Dr. David Wairoto, a psychiatrist and a member of the Kenyatta University Wellness Center, who's going to take us through anxiety and its disorders. But before then, take a look at the health updates. Very interesting health updates right there. And like we said, we are having Dr. David Wairoto, a psychiatrist, who is going to be taking us through anxiety and its disorders.
Dr. David Kagwe Wairoto. I'm the chairman, Department of Psychiatry and Mental Health. That's the School of Health Sciences, Kenyatta University. I'm also a lecturer in the department. So anxiety is a mental disorder. It's actually the most common mental disorder we encounter in the world. And being anxious is a normal body reaction to stress or anything which is life-threatening. So for example, if you walk around here in KU, you perhaps hear the sound of a strange animal, you will get anxious. So being anxious is normal, okay? And all of us actually get anxious, yes. So for normal sadness or stress, this is when someone now encounters a normal activity in their life, perhaps work or school, and because of this activity, you get overwhelmed or you get stressed. But for us now in mental health, when we say you have anxiety, which has made you develop anxiety disorder, it means you have excessive worry and nervousness about normal life occurrences, which occurs for a period of more than 2 weeks. It affects your work and also your life. So that's how we say now someone has developed an anxiety disorder. So there are many kinds of anxiety disorder. The most common one we have is generalized anxiety disorder. Number 2, we have something called social anxiety disorder. We have panic disorder, which is very common, especially with the teenagers. So for the viewers, you may notice with high school pupils or students, many of them get anxiety. We have phobias. So there are some individuals who will actually fear animals. They'll fear being in lifts. They'll fear being alone. So that's kind of phobia. And lastly, we have obsessive compulsive disorder, which we'll talk about later in this program. Thank you. So for anxiety disorders, evidence shows that it affects females more than males. The reasons are not very clear, but we believe because women have more emotional burden, they're also the homemakers, they actually get more involved in traumatic experiences, and that's why for many of them, they actually develop anxiety disorders. Now, for some individuals, anxiety can be extremely debilitating. During the COVID-19 pandemic, many people actually feared getting COVID. As a result, many of these patients avoided leaving their homes, and as a result, they suffered in terms of job and even their life. So yes, anxiety is debilitating, and when it's debilitating, it actually requires treatment or intervention from a trained mental health worker. So now with social phobia, we mean that individuals avoid situations whereby they have to interact with other human beings. So you may find if it is going to school, this individual or work, they'll actually prefer working virtually or online. Now, how you differentiate it from the other disorder is the other disorder someone may be able to work through it, but for phobias they are extremely debilitating, and these individuals will actually suffer a lot. So for any phobia, these are individuals who perhaps will also have another mental disorder, which we may need now to check for, because with phobias, the teaching is there's always another mental illness, which is making them have the phobic disorder. So we've said anxiety is a normal event in life. You worry about excessive things, you feel your heart beating quickly, you have palpitations, you have sweating. But for now one to know that this is extremely severe, you'll have recurrent or repeated symptoms for a duration of 2 weeks. So you'll have 2 weeks of similar symptoms, and as a result of these 2 weeks of similar symptoms, you'll actually notice that one, you're avoiding work, you're avoiding school, so your colleagues or your friends may notice a change in behavior, and when this happens, you need to come to hospital. I also repeated that anxiety disorder, I'll repeat, sorry, is the most common mental illness in the world, and we said it affects around 3% of the global population. After COVID-19, we actually think that it has gone up to even 6% because of course, things to do with the finances, and also now also other anxiety causes in life. So we teach our level 3 students that the following factors actually may make one at risk of developing anxiety. The first is we have adverse childhood experiences. So people whose parents have had separation, people whose parents have had divorce, individuals who perhaps have gone through poverty, history of substance use, whether it's alcohol, cannabis, sativa, people unfortunately who have been exposed to traumatic experiences like the recent floods in Kenya, people who have experienced war, people who have experienced what we call trauma from a relative. These are individuals who unfortunately will be at risk of developing anxiety disorder. We also have genetics, and as you know, for any medical illness, genetics or family traits play a big role in one developing a mental disorder. Now, separation anxiety is a common phenomenon in all children. So all children develop attachment with their parents or their guardians. So what usually happens when these parents or guardians leave the space around the child, most children develop anxiety, and that's what we call separation anxiety. Now, when it becomes severe is when the child cannot be able to deal or cope with the parent being away from their presence. So for that to be recurrent, the parent has to observe that this child actually, when they separate from them, the child develops tantrums, they don't eat their food, they develop mannerisms, but when the parent comes, the child goes back to the normal state. So for all children, separating from their parents is a normal occurrence. They get anxious, but most children will be able to deal with it by the age of 2 or 3. When it's persistent, we tell the parents or guardians to now seek care of a trained professional, whether it's a medic or a mental health professional who can assess and then now refer the child for mostly behavior modification. Remember, for children, we are extremely conservative, so there's no role of medication. We actually do behavior modification. Now, panic attacks are extremely common, and the age of occurrence is between 13 and 21. It is a form of anxiety disorder. So most patients will come with feelings of death. They'll come saying they are choking, they have difficulty in breathing, some may complain of severe headaches, some may complain of having severe abdominal pain. They'll report to casualty or to their clinic or health facility. The doctor will do an assessment and he'll check for medical causes and he'll find none. So when they find none, now this is somebody who now will be sent to a mental health worker for assessment, and our assessment will find they'll have a panic attacks. Panic attacks are caused by excessive stress, excessive anxiety, and nervousness. So it's a form of also an anxiety disorder. But we said very common in the teenage years between 13 and 21. So sometimes it comes before examinations, many times. It comes maybe after having a problem perhaps with discipline in school or a stressor, but very common with teenagers. But also very easily treated with very few medicines, but mostly therapy. Now, post-traumatic stress disorder is what we call a traumatic kind of life event. It's not a form of anxiety. PTSD is actually a traumatic experience. It's classified with acute stress disorder. For PTSD, someone will have intrusive thoughts, they'll have flashbacks, excessive stress for a duration of more than a month. PTSD is extremely debilitating. It's a disease which we are commonly encountering because we are finding some of our officers in our disciplined forces going to what we call conflict areas such as Boni Forest, such as Somali theater, and for those individuals they need expert help and expert support. The main thing, when you think you have anxiety, the first thing I would advise you, go and do a self-assessment, okay? So when you go online, I'd like the viewers to know to open online and look at GAD number 7. You go and do an assessment tool called Generalized Anxiety Disorder number 7. These are what we call self-rated questionnaires. You will fill some questions online. At the end of that online assessment, you'll be able to score yourself and be able to know whether you have anxiety. Once you score yourself and the score comes positive that you have anxiety, I would now seek the support of a trained mental worker. And here at Kenyatta University, we have qualified psychiatrists, we have qualified health counselors, or what we call psychotherapists, who can assist you in getting treatment. So the role of family is extremely important because, one, remember we're in Africa and family is the keystone or the corner of support. So a family will help an individual with anxiety disorder or any other mental disorder. One, they'll help them to adhere to treatment. You see, for us, our families, we take people to hospitals, so taking them to see the doctor, the psychologist is important. Adhering to medication, what in medical jargon we call compliance or treatment compliance, extremely important. And number two, helping to deal with the triggers or the stressors. So if you find it's parental separation, your mother and father separated, they got a divorce, they are not talking to each other, that may make the children prone to develop anxiety. So if the parents can be able to have cordial terms, talk to each other, stop arguing in front of the children, substance use, stop taking substances in front of the children, these are things which will support. Remember also in Kenya and in Africa, we have extended family. So your auntie, your uncle, your grandmother, these are people who will add and support you in treatment. Okay, so in mental health, we say the more the better. So if you have even a larger family, your prognosis, and they are extremely supportive, your prognosis is much, much better.
We're taking a short commercial break. Don't touch the dial. We'll be right back. But before then, take a look at the Did You Know segment.